Hi, welcome to Detours Understanding Acquired Brain Injury. And today I want to talk to you regarding a question that I've gotten a couple of times. And that is, either who should I go to about my brain injury, what kind of doctor, or I have a neurologist, but they really don't seem to understand much about brain injury. Why would my neurologist not understand about brain injury? So, I want to talk a little bit about medical education as it is today. Now, I want to start this with a caveat, and that is there are differences from medical school to medical school and residency program to residency program. They're not significant, they tend to be small, but these affect training and what a physician may be exposed to. Another thing I want to emphasize here is that there are two different kinds of physicians in the United States, or two approaches to medical education, I guess I should say. There's the MD, the doctor of medicine, and there's the DO, the doctor of osteopathy. Now, many years ago, this was a significant difference. But over time, it's evolved so that the MD and the DO are pretty much the same thing, with a few little coarse exceptions and philosophical differences. They're pretty much the same thing. Now, there are those who would throw rocks at me for saying that, but I'm not interested in extremists and philosophical quibbles about this. Practically, for what matters, the MD and the DO are pretty much the same thing. So if you see MD or DO behind the name, you're a physician, it's pretty much the same thing, especially when it comes to brain injury and what it matters, and neurology, psychiatry, the person who does surgery on you. Although that may be something you can make an argument with, you're less likely to see a surgeon with DO behind their name, but they are out there. So realistically, now in other countries, that's different, and that's the third point I want to make. In the United States, DO is a full-fledged physician. That's an important word here. You hear the word doctor thrown out a lot. Ignore that, because there are so many different professions that use the word doctor. It's physician that is key, because there are doctors of history. Doctor just refers to the highest educational degree in the academic system. Many doctors in other countries are what we would call who are physicians. The physician has a master's degree instead, and you only get the doctorate if you are teaching. Doctor comes from Latin, meaning to lead or to teach, depending on, the way you use the Latin, but they mean the same thing, and it refers to the fact that most people with a doctorate teach. They're at the universities because they have the highest level degree. But physician refers to those who are of the healing arts, of that kind of, comes from the word physic. All right, that and enough. All right, let's get into this, and we'll look at generally how medical education works in the United States. First of all, the 10th Amendment of the United States Constitution, we have to go to a strange place for this, delegates education of health professionals generally to the states. Again, unlike other countries, medical education is handled by the individual states. This is why a doc can't write you prescriptions, why a physician cannot write you a prescription. And yes, I will use them interchangeably. I'm well aware of they can only generally write for a state which recognizes them. Their authority to practice comes from a state medical board. Okay? State. And it is the state medical board which was established by the state legislature. Authority to practice medicine, nursing, acupuncture, whatever. Anything that you're licensed in comes from the states. And it is the legislative authority that grants a medical professional, a legal professional, whatever, the right to practice their discipline. It is state legal authority, which allows them to do the things they can. It's not that the wisdom fairy comes in and kisses you on the ear or anything. It's state legal authority. And the board then is delegated the authority by the state to determine licensing, education, what is necessary, all that good stuff. And that comes through the fact that the U.S. Constitution says, hey guys, this is in the hands of the states. The Constitution actually limits powers of the federal government. Just as a quick note, the Constitution does not grant powers, it limits powers and says anything that's not in the Constitution, that's the states. Just so you know. Okay, so if it's not written down as a federal authority, everything else is the states or individuals. It's the general clause, number 10. Okay, so all the different state medical boards and everything else back in the early 1900s got together and they created the Federation of State Medical Boards. And this organization is a nonprofit kind of corporation. And their job is to kind of oversee through other organizations. Of course, this is like a Russian nesting doll, one inside the other. Their job is to oversee education, set up, kind of work with these other organizations for MDDO to make sure that medical education works the way it's supposed to, that the state boards want. And then they'll check they'll check the regulations and make sure that the state medical boards pass what they're supposed to. All right, so you've got that organization. And then there's the National Board of Medical Examiners, who make sure that the exams are fair and that they are up to snuff across the states, and make sure that there's equity regarding these. Now, obviously, there's debate about that. They're saying, wait a minute, no, this is not, maybe leaves out a group of, minorities or disabled people, men, women, whatever. So obviously there's controversy, but that is their job. All right, so there are 71 throughout the states, the U.S. territories, and everything else. There are 71 medical and osteopathic boards, just so you're, aware. So now, first of all, if you want to become a physician, MD-DO, you need to complete your pre-medical track. This is important to note. Pre-medical is not a major per se. Some universities kind of try to bundle it that way, but it's typically a science field, biology, chemistry, they try to bundle it that way many times, but it's really not a major. This is a track. So if you're a music major, you can take the required courses and get into med school. It happens. It's not unusual. I mean, it's not as common as, say, a biology major, or a chemistry major, a physics major, a math major, who, by the way, math majors have the highest MCAT scores. We'll get to what the MCAT is in a second. But yes, so it's not necessarily a major. But let's say we have an aspiring doctor aspiring physician, or aspiring 18-year-old kid who wants to become a neurologist, specializing in brain injuries. What would they have to do? So, they have to complete certain requirements by the state boards that, through the medical examiners organization, have required. So what's generally required to get into medical school? Biology, 2 semesters with a lab. And this is important because lab courses tend to be more rigorous, more mathematically driven. A lot of the non-science majors tend to not have to require as rigorous a lab. Physics, typically 2 semesters with lab. General chemistry, 2 semesters with a lab. Organic chemistry, 1 or 2 semesters with a lab. Again, that depends on the school, but typically it's 2 semesters organic chemistry with a lab. Biochemistry, again, sometimes, but typically 1 semester. English, of course, we all know, they want you to have at least 2 semesters because they want you to be able to write technical writing typically, and an introduction to writing typically, and math, 2 semesters. At least 1 semester of calculus and 1 semester of statistics, although some schools are now saying, all right, 2 semesters of stats. And part of the reason why is a lot of research studies are driven by statistics, and you have to understand how to do a research study. So they may want you basic and advanced statistics so that you could do and understand research studies. When I was studying towards my PhD in neuropsychology, I had to take basics and advanced statistics because it's key for a lot of sciences. Um, After you're done with that, this aspiring young physician who wants to be a neurologist then has to take other steps. Typically, they'll take these in their late sophomore, early junior year, so late second, early third year. They will apply through the AMCAS system, basically the American Medical Colleges application system. So a computer which will like send applications automatically out to multiple medical schools for them. And you have to meet those certain standards. You have to have certain grades and things like that. And then your score will come, your application, a second app will come back to you if they're interested in you, which schools are interested, or nothing. Depends. And then you have to generate a personal statement, why you're interested in becoming a physician, that kind of thing. You need recommendation letters, both from science faculty, people like that, people who know your character, that kind of thing. Typically 3, 4, the people who know you well, who know that you'll be a good person, that you're competent, capable. They want to know, the medical schools that are looking at you want to know what kind of extracurricular stuff you do. Are you involved in athletics? Are you a hard worker? Are you doing things for the community? Do you volunteer? Are you a paramedic, perhaps? Many students are interested, and I've worked with them when I ran EMS. Many aspiring medical school students ran as medics, and they volunteered that way, and that was a way they served their community. There are others who did charitable activities, worked soup kitchens or through their church or things like that. They want to know that kind of thing. They also obviously want to know what your GPA is, minimum of a 3.5 out of a 4.0 scale. Some schools use a different system. So they want you to be the term well-rounded. That was kind of drove me a little, but hey. Also your MCAT, your Medical College Acceptance Test, which looks at things like your science performance and gives you a score on that to see how well you have mastered the biology, your chemistry, your physics, those kind of subjects, to see whether you have what it will take when you start medical school. And then they will vote. The admissions team will look at and vote whether they think they'd like to accept you, whether you have what it takes. There's a lot of argument, again, about how biased this process is, things like that. So there's a lot of, and some schools work differently. But this is, again, the typical. All right, med school. So med school's goal, if you get accepted into med school's goal is to teach you in those 4 years to be a general physician. It is not to make you into a specialist. That comes later. It is to make you a qualified and competent general practicing physician. It is to make you like a family doc. It is to give you the foundation to be competent to take care of a regular, like a regular patient, a sick person who comes in, something's wrong, I'm having trouble with this. That is what med school is about. And to give you that foundation to go from there. So your general PCP, who actually typically has more training than that, typically a residency in family medicine, won't know much about brain injury. We'll get into why after we talk about med school here. All right, you've gotten in. And the first 2 years to start, forgive me as I go through my notes because it's complicated stuff. Your first year typically is a lot of lecture and lab kind of stuff. Gross anatomy, working with the microscope, doing microbiology, learn brain and behavior, epistemology, with certain philosophy type courses, philosophy of medicine, introduction to clinical medicine, embryology, how people develop from embryonic state up to birth, all these different kinds of things. And these are foundational medical skills. Generally, they're not really medical students, which is what they are at this point. They're not physicians, they're not doctor anything, they're Mr., Miss, Ms., whatever. And they won't be anything like that till they're ready to graduate. You'll often see them walking around with the patch from their school and it just says medical student. They haven't even received the white coat yet. White coat ceremony will come usually later when they're ready to head out, but not yet. They're still in school and they're still learning the foundational basics. First year. They also need to learn very basic skills, blood pressure, taking blood pressures, and all that kind of stuff. Now, not every school structures the same way either. Schools will structure it differently. However, these are foundational, fundamental skills. All right, so second year finally is where they're starting to do, they're going out into their clinics, their school's clinics. And there are certain requirements that the school may have for them. They don't really get to choose as much. Things like learning basic internal medicine, general, hospital kind of care for the guy who comes in with breathing trouble, or the guy who's dislocated his shoulder, the lady who's got, abdominal pain, that kind of stuff. Learning the foundational skills for caring for patients with this, integrating the science with the clinical care, bringing that together. Psychiatry and neurology, learning about taking care of people with psychiatric problems, learning the basics. Again, they're just eyeballs. They're not touching anyone. They're not doing anything. They're watching, they're taking notes, they're listening, learning from the residents and the attendings. And this is important. Again, medical students at the bottom, and then there are the residents above them, then there are the fellows, and finally there are the full attendings at the very top. These folks are the fully qualified physicians with all of their license and their certifications and board certified. Medical students are just eyes. They're watching, they're taking notes, they're asking questions, they're being questioned by their teachers, their professors, their instructors, and the senior residents. And all right, so learning surgery. Again, they're watching, they're learning, they're new at this. So they're learning communication, they're attending seminars, things like that. They're building their skills. Finally, they're also studying for something important. To get your license in the United States, there is a 3-step exam, U.S. Medical Licensing Exam, the USMLE. Step 1 is taken at the end of the second year of medical school. You are not licensed as a physician until you complete that 3rd step, Step 1. And Step 1 is basically a pass-fail exam. It used to be scored differently, but it's just a pass-fail. However, it is a long exam. It is over a period of 7 hours. There are multiple blocks. It is administered. It is multiple choice. And basically what it is basic medical science. The stuff we were talking about that they learn at first and throughout their second year, even though they're going out and watching things, they still have to keep working on their basic medical skills. So microbiology and learning about histology, tissue samples, learning about some of the basic, like how chemistry applies, organic chemistry applies, and medications, pharmacology, these fundamental skills that they've been learning over the first 2 years. This is a pass-fail test, but it is a grueling one because it lasts the whole day. They get periodic breaks, but over this day, they have to pass these various components of their test in order to be able to move on. You have to pass the USMLE, and it's also expensive, a couple $100 to take this exam, and they still have 2 more components ahead of them, pass-fail. They have to retake it if they fail it, and some residency programs look at whether they passed or failed this, and when it was a scored test, they used this to decide whether they would take them even. All right. 3rd year. Now this is where the clerkship, what's called clerkships, happen. Your young medical student moving along. These are clinical rotations, finally. This is where the school says, all right, we want you to do like a rotation in family medicine, OBGYN, surgery, psychiatry, pediatrics, and maybe 1 or 2 of your own choices, what you're interested in. And this gives them more in-depth exposure to things that are kind of foundational if you want to be a general physician. Remember, that's your goal here, is to complete this and become a solid physician that knows these kind of skills to be a general practitioner that doesn't need supervision. So you can take care of any old person. Okay, so you'll do these rotations. Again, you'll interact with, you may ask a patient questions, you'll do the clinical interview, you'll then talk with the resident or attending and say, hey, this is what I would do, I think this, that, and the other thing, and then the resident attending will go do their own kind of thing. But still, this is solid foundation and gives you the sample that you need to say, okay, I'm really interested in this kind of thing. And prepares you for the fourth year, where, again, you're still taking a lot of those final kind of courses where you're thinking, all right, these are the skills that I need to cement what I'm doing, the symposia and stuff like that. But so that's what you're doing this year. You're really getting a solid sampling of like that box of chocolates, that assortment box of chocolates, kind of this, and the other thing. This is how it works. This is the kind of things they do. So you're seeing what kind of skills are involved, what kind of equipment you'll need, and how they do, like learning, like CT, MRI. It's not, you're not learning in depth yet, but you're at least seeing what's involved. Again, you're still a medical student. You're still learning the foundations, but you're moving further along. You're developing those sets of skills and building upon what you learned in the first 2 years. Finally, by the fourth year, this is a year where a bunch of important things happen. First of all, for your fourth year, you are going to pick a lot more of your own stuff, a lot more of the courses that you're interested in, things that are related to, which you think is going to be your potential future, because this is it. Also, like clinicals, for example, might be anesthesiology. Maybe you want to become an anesthesiologist. Maybe you want to be a dermatologist, an emergency physician, an ophthalmologist, a radiologist. So you may choose those areas and a little more focus. Also, are you going to do like an international study? Are you getting involved in research, residency programs like that? What other activities, are you getting involved with? Are you getting involved with the journal? Are you one of the 20? Are you like the 28th name out of 60? Maybe. Are you helping doing studies? These are all things that are appealing and attractive to residency programs, because you are now going to be taking U.S. medical licensing exam, the USMLE Step 2, clinical knowledge. This is another long test, which you have to take to demonstrate that you can apply what you've learned clinically to help make diagnoses and to help figure out, this is what was going on with this patient. They have this condition, that condition. This is the appropriate treatment, that kind of stuff. Based on those clinical rotations, those little clerkships you did, going to, internal medicine, cardiology, whatever. So that's how you learn those kind of skills. And so that is what Step 2 is about, the clinical knowledge. There used to also be a clinical skills portion. There used to be a 2-part test. And Step 3, which is coming a little later, is a 2-part test. But this is a multiple choice question. It is broken up into 8 sections, and you get a 3-digit score. And 214 out of 300 is what you need to pass. Obviously, performance is variable for this one, but you need a minimum of 214 to get a passing score on this one. This score is also used for what you're doing next, which is residency match. If you want to be able to become a resident, what you have to do is you apply for your residency. And the American College of Graduate Medical Education, this is one of the things they do. And this is an organization that is another nonprofit organization that helps arrange and coordinate education residents. Residents are doctors now, because if you've been successful, you've gone through your 4th year successfully, you completed all the things you're supposed to, you graduated, you are now a a medical doctor or doctor of osteopathy. I'll call you doctor because you completed your doctorate, your doctorate. Thing is, though, you are not licensed and you cannot practice. You may have your doctorate, cannot practice. And this is a big problem if you fail to match. Every doctor that practices has a specialty of some sort. And every year, there are a few thousand who fail to match. This is a big problem in this country and in other places too. They're working on fixing those regulations. But failure to match means you cannot practice because you do not take that third step. And you need that third step in order to practice. This is just a little note to make. All right, so you apply to a broad variety of programs that you're interested in. Let's say you're interested in neurology. So you apply, you have to send out your CV, you got to send your grades out. It's almost like applying to medical school again. You go through the match system, a computerized system that will try to match you with your different choices. And some programs are way more competitive than others, depending on what specialty you're interested in. Some you virtually are guaranteed to match with somebody. Others, 1 or 2%. So many young docs choose something that they really like and something where they have a high probability of matching into. This is just the way it has to go. They send their CV, they send statements, they send letters of recommendation from their medical school, they interview. Sound familiar? It should. And this is at the beginning of the year, and then they wait for notorious match day towards the end of March, where the residency programs will go looking through and decide who they want based on, unfortunately, quite a bit on how they scored on the USMLEs, but also based on a lot of the other stuff too, and their grades. But unfortunately, a lot of them do base it on how they scored. All right, so now you match into a residency program. After you have completed your 4th year, after you have, passed the USMLE step 2, and you have matched, great. First year is typically called your internship. So when you encounter somebody who's an intern, typically they're doing their first year of their residency. Residencies vary in length depending on what specialty you want. A neurology residency, a psychiatry residency, a physical medicine residency, which would be one of the 3 that you want if you want to specialize in brain injury, they last 4 years. That first year is typically, not always. Always got to put an asterisk with medicine. Typically, not always. First year is your internship, and they study internal medicine. General care focused on working with patients. You are a doctor. You are not yet licensed for that year because you did not complete step 3. But you are now going to be working with patients. You're going to be coming up with a plan because you do have the general knowledge now, like any other fully fledged physician, but you're a generalist, not a specialist yet. That's what residency is for. So you now are going to look at them for general medical care. You're a neuro patient because they're starting to shape you to think like a neurologist, a psychiatrist, a physiatrist, physical medicine doctor, rehab doctor. Great. All right. So after that, you will do your internship year as an internalist. And it's general assessment for general sick person. And then you will take USMLE step 3 at the end of that year. And so that is a 2-day test, 2 parts. The independent practice part, which asks you about like how you would run your practice. It presents and exposes you to lab results, and like it gives you a fictional patient and what do you do for treatment, what kind of medications, and that kind of thing. An advanced clinical practice, the second part. Remember, this is over 2 days. And for the same thing, you get a 3-digit score. You need 198 to pass. This is a pretty rigorous test because it's 2 days, 9 hours for each. If you pass, congratulations, fantastic. These scores matter too, depending on what you're going to do after. But you pass, you could, in theory, after you complete your next year, apply to be a fully licensed physician. The problem is you would be then just a general practice. You want to be a neurologist. You want to be a psychiatrist. You want to be a physiatrist, right? So you got to go from here. You complete your postgraduate year 1 or your internship year 1 by caring for patients and providing for their general needs throughout the hospital. A lot of watching, a lot of recommending, a lot of asking patients coming in. This time you'll have Dr. So-and-so on your badge, and it'll might say intern or something like that, but that is what this year's about. Second year, you're now officially called a resident. You're called an intern before, you're now resident. All right, so with being a resident in most neuro programs, they'll expose you in that second year to a wide variety of neurological patients. Inpatient, outpatient. They'll have you running all over the place. Different clinics that they have, different, they'll have you in like the neurophys lab, the seizure lab. They'll have you, and you'll get some brain injury patient exposure. But they want you everywhere and anywhere. They'll want you in the dementia unit. They'll want you all over the place. So maybe you'll encounter 1 or 2 brain injury patients, maybe, over 2 semesters. It's good for vast exposure. You will be reading and studying your books. You will be answering professors' questions. You'll be doing rounds. So you, with a gaggle of other people, and your senior attendant and your senior resident, schlepping down the hall and getting questions. Move on down. So that's your second year. Pretty broad range of experience, but you can't really focus on one thing. All right. Third year is your consultancy. This is where, in a lot of programs, they'll have you acting as a consultant based on your experience and what you've learned to, say, the stroke unit, say, to pediatrics. And they'll rotate you through like ambulatory, and they maybe have you do an elective, an area you want to focus on for a month. But, again, a broad variety of exposure. But you're not there to be a specialist in sub areas. You are there to be a specialist in everything neuro. So you're not going to get that focus in just one thing. Your job is to learn as much as you can in as many neurological disorders as possible. And that's why they'll move you around quite a bit. Fourth year, you are teaching. You are teaching that first and second years. You are running labs. You're even teaching medical students. Remember how I mentioned about back in med school about residents and to help teach you when you're just eyeballs? This is what I'm talking about. Senior resident. You may be teaching some, more advanced conditions. You may be doing research and stuff like that. You may be involved with, if you're, popular with the professor or whatever, you may be helping them out with that kind of stuff too. You also may be doing time in the electrophysiology lab, interpreting ECGs, or EEGs, Blech. You may do a rotation through the electrophysiology lab. That may be one of your rotations. I don't know. You may be learning neuroradiology. You may do a rotation through psychiatry. A lot of neurologists do. But the goal is to make you as much of a generalist within a specific area. This is why. 30 minutes to answer that question. Why doesn't my neurologist understand specifically about my brain injury? Why? Because the goal is to make them a generalized specialist. Brain injury is a hyper special problem. In order to do that, they have to take one more step. So what happens now? When you've completed your residency, you've got a couple choices. One, you are board eligible. What does that mean? It means you could take a test and become board certified if you've completed the right number of hours and you have the, or you could go for your fellowship. Fellowship is a subspecialty. That subspecialty allows you to pick a very, very, very narrow discipline within your residency area. So like, say, brain injury medicine. This is where people who know about brain injury come from. So what you do is you take your board certification, because usually that's what's required in either neurology, psychiatry, or physiatry. By the way, psychiatry and physiatry, it's the same kind of process. They want you to have as much broad experience as possible in a whole lot of stuff. Then, if you want to be a super specialist, then you look at fellowships. And the fellowship process is pretty much the same as getting into a residency program, because you have to, at that point, apply through what's called ERAS, which is the residency application system. You have to submit your CV. You need 3 or 4 letters of recommendation. You need to give them your grades. For med school, you need letters from the residency program. Are you fit? Then you need recommendations and an approval from your grad school saying, yeah, this person would be great for that program. So your performance. Did you do research? Again, should sound familiar. And many times, fellowship slots are far fewer than residencies. Residency slots are already pretty tight to get into, and they're funded through Medicare and Medicaid, by the way, the residency slots. It's even tighter when it comes to fellowship slots. This is why there's so few brain injury medicine subspecialists. And then, if you're accepted, it's the same kind of process, like don't want after an interview and another personal statement. So you've applied for med school, you've applied for undergrad, med school, now and residency, now you're applying for your fellowship. Same rigorous kind of process. You get accepted. Now you will spend the next year with nothing but brain injury patients only. And you are a fully qualified physician. You are Dr. So-and-so, and you are a board certified or board eligible neurologist, physiatrist, or psychiatrist. You complete that year-long focused training in just one thing. When you complete it, then you can sit for the subspecialty exam. Now, you have somebody who's an expert in brain injury, because that is all they studied for the last year. But it takes all that schooling, 4 years undergrad, 4 years medical school, 4 years. It takes 13 years, sometimes 14, depending on the program, to make a brain injury medicine specialist. Why doesn't my doctor know? Typically, they haven't done that fellowship, that focused. And your typical, it's like you're talking 32 when you're finished or you're coming out. If that's your dedicated focus, sometimes 33 years old, and they're brand spanking new at it anyway. It takes a long time to complete that kind of thing. So this is one of my longest videos, but I did want to make it clear what it's involved, how difficult it is to get that medical education, how many steps, how rigorous it is. And the fact is, we still only know a small amount about brain injury, and that we're still learning, and what is involved in becoming a brain injury specialist. And the fact that you're a neurologist is still a generalist. They are a generalist in all neurological conditions. So why don't they know? Because their job is to learn about everything that they can about neurology, about the brain. You're a psychiatrist, everything that they can learn. And then over time, they get more focused through self-education. But this is why they don't know about your brain injury. You are the expert in your own brain injury. That's what you bring to the table and you need to advocate for. They know about the nervous system in general, but you are an expert in your own brain injury. This was Detours. Thank you for watching. Please click like and subscribe. Hope you enjoyed it. Hope you found it educational. And see you later. Bye.